going to see the breath holding spell. We have cyanotic type and pale type. The cyanotic type, both types occur most time between 6 months and 2 years of age for the baby. The breath holding spell is the transient apnea of the baby that occurs in response to a trigger. The triggers for the cyanotic type is the crying, or the crying, or the not too much like trauma, but the, let's say, the frustration. So here is the baby for some reason or another is crying and then suddenly a apnea, or the patient, the baby wanted something, for example, I don't know, play something with something, and the mother says no, and so the baby is frustrated, and so begins to have this apnea. The apnea, we have apnea plus cyanosis plus rapidly recovering of loss of consciousness. So the patient has loss of consciousness but rapidly recovering. As opposed to the pale, here the patient would be pale, not cyanotic but just pale, with bradycardia and the apnea. Here there could be or not the loss of consciousness, but if there is loss of consciousness, it would last less than 5 minutes. So it would not be, maybe it would not be completely rapidly as the cyanotic type, but here we can or not have it, but if we have it, would be not instantaneous recovering as here, but anyway, it lasts less than 5 minutes. And here the triggers are fear, pain, or minor trauma. So on the breath holding spell, we can have cyanotic type or pale type. They are kind of the similar triggers. For cyanotic type is crying and frustration, and for the pale type is minor trauma, fear, or pain. They both have apnea. In the cyanotic type we have cyanosis, in pale type we have pallor, and in the cyanotic type we have rapidly recovering of the loss of consciousness. In the pale type we can have or don't the loss of consciousness, but if we have it, it would be rapidly recovering as opposed to other conditions, not as quickly as the cyanotic type, but less than 5 minutes.